What causes wound dehiscence after surgery? Imagine going through surgery and thinking you're on the mend, only to find your wound starting to open up again. That can be a confusing and worrying experience. Wound dehiscence is when a surgical incision or cut reopens after the procedure. It can happen soon after surgery or during the healing process. This condition is also called wound breakdown, wound disruption, or wound separation. The main reason this occurs is because of infection at the surgical site. When bacteria get into the wound, they weaken the tissue that is trying to heal. This makes it easier for the wound to reopen. But infection isn't the only cause. Poor nutrition can slow healing too. If someone is not eating enough protein or vitamins, their body might not have the building blocks needed for tissue repair. Certain health conditions like diabetes, cancer, or anemia can also interfere with healing. These illnesses affect how well the body can recover from surgery. Some medications, especially steroids, can weaken tissues and make wounds more likely to open. Increased pressure on the wound from heavy lifting, coughing, vomiting, or constipation can also cause problems. When you strain or put extra pressure on the area, it can cause the stitches or staples to break. Obesity is another factor. Extra weight puts more stress on the surgical site. Smoking reduces blood flow, which slows down healing and increases the risk of wound opening. The way the surgery was done matters too. If the stitches are too loose or too tight, they might not hold the wound properly. Emergency surgeries can sometimes lead to wound issues because the body might not be fully prepared for healing. Wound dehiscence can be superficial, where only the top layers of skin separate, or deep, where muscles and tissues underneath also open. Deep dehiscence is more serious because it can expose internal organs and needs urgent medical attention. If you notice your incision starting to open, it is very important to contact your healthcare provider right away. For superficial cases, they might recommend wearing a support belt to reduce strain. If the wound is deep and the internal tissues are exposed, emergency care is necessary to prevent further complications. Monitoring for complications is key. Keeping an eye on signs like redness, swelling, or pus can help catch problems early. Managing your medications and health conditions properly can also reduce risks. Following your doctor's instructions on wound care, avoiding heavy lifting, and reporting any signs of infection promptly can help prevent wound dehiscence from happening.